Hey guys, Dr. Scott Nall here from thevillageosteopath.com. And today we're going to talk about a very exciting topic that everyone's been dying to hear about. Insurance billing. Boo. The reason we're going to talk about this is because we get multiple calls a week from people wanting to be patients here that currently have Medicare insurance. And unfortunately, we don't have a contract with Medicare. But because of certain rules, we're unable to see them here at the office, even if they pay cash. And usually this ends up not ending well on the phone because it's a very complex topic to talk about in just a couple of minutes. And usually, our front desk staff either gets chewed out and we're either told that we hate old people or we're discriminating against people or some horrible thing, and that's really not the case. So what we're going to do is talk about that. So just hang around after this intro and we'll get down to business. So before we can talk about how Medicare works, what I wanted to do is talk about how commercial insurance works. Because commercial insurance, even though it's very confusing, it's not nearly as confusing as Medicare. Because it kind of acts under traditional business practices. In other words, it's very contractual. So if you've ever been in a contract before, it's kind of the way just regular commercial insurance works. So up here we have commercial insurance. Let's say we're going to talk about Cigna or Blue Cross Blue Shield. You just put any commercial insurance company up here. That's why I put E, et cetera, et cetera. And then there's different clinics. So let's say we have clinic A, B, and C. And each one of those clinics has a group of physicians that work there. So here we have A, B, and C. And then clinic B, physician A is actually working at the same clinic over here. So this guy is sharing two different clinics. And then physician B is working in A and C. So, trying to make it real confusing by putting a bunch of letters. So you can just kind of see that every clinic has a group of doctors, and some doctors work in more than one clinic. So what happens traditionally is that the clinic will contact the insurance company and say, hey, we have a clinic here and we'd like to participate in your plan. And so the insurance company will then send a packet to clinic A and clinic B or whoever contacts them, and then each clinic will fill out an application and it will list all their physicians at that clinic. Well, let's say that clinic A wants to participate with Cigna Insurance. And so what they do is they fill out an application and they say, yeah, doctors A, B, and C are all going to be participating in this insurance plan. And Cigna says, okay, and it ties that contract with the clinic. It doesn't tie the contract with the doctor specifically. Okay, that's a big key because we'll see in Medicare it's totally different. Now, clinic B, let's say clinic B doesn't want to take Cigna, but Dr. A still works there. If a Cigna patient were to come to clinic B and see Dr. A would not be able to bill Cigna in that case. They could still see them and pay cash, but they wouldn't be under any obligation to bill an insurance company in this situation. The same thing if clinic C, let's say they wanted to take Cigna here and they wanted to take Cigna here, then Dr. B, who works at both, would be billing Cigna or whatever commercial insurance from both clinics. So as you can see, the big thing with commercial insurance is that they go to each individual clinic and then they can pick which doctors in that clinic want to participate and which ones don't. If you don't want to participate, you can take cash. There's no rules or regulations against that. But if you're in an insurance contract at a certain clinic, you have to follow their rules. And usually those rules are procedure is something that the insurance usually covers. You have to send in a bill. That's just in your contract. So now I'm going to erase all this and we'll talk about how Medicare is different and why it's really difficult to explain this on the phone. So I hope this helps. Okay, so now we're back and now we're going to talk about how Medicare works. As you can see, it's a lot more confusing because there's lines going everywhere and big circles up here. The difference is that Medicare does not act like a traditional contract. There's a step that comes before all that happens, and it has to do with opting in or opting out. And that's just kind of terms that Medicare has come up with. So so Medicare, instead of going to each individual clinic first, it goes to each provider first. So nurse practitioner, physician assistant, physician, physical therapist, doesn't matter what kind of healthcare provider you are. Medicare wants you to have something called an NPI, a National Provider Identification Number, and it goes to that person first, and it says, okay, doc, what are you going to do? Are you with us? Are you without us? And so the doctor has to make a decision at that point if they're going to opt in or they're going to, let's call it, opt out. Okay? And so once you opt in, you're opting in no matter where you are. That status follows you around no matter what clinic you're in, no matter what state you're in. It doesn't matter. Once you're in, you're in. If you opt out, there's a little catch, because Medicare doesn't like doctors to opt out. So what they do is they put a freeze on you if you were to opt out, and it makes it to where you can't opt back in for at least 2 years. And then it's kind of a long process to get back in. So in today's kind of tumultuous healthcare climate, aka the whole system could change every election cycle that comes around, opting out is kind of scary for a physician. Because it could be you're opted out and then all of a sudden, what you're doing isn't legal anymore or something like that. So we really don't know what's going on. So most doctors stay opted in. So once you're opted in, that means you have a few regulations that are placed upon you as a physician. And that means no matter what happens, whether you're in a contract with Medicare or not, you must bill a claim to Medicare if you see a Medicare patient for something that's normally covered under Medicare services. So what does that mean? Well, there's another step, and it's called par, non-par. And this is kind of the contract part. So Medicare will then go to each individual clinic. So we have clinic A and B, and let's say Dr. A works at each one of these clinics. And in one clinic, Dr. A is considered par, meaning he's participating, and Dr. A has signed a contract with Medicare at this clinic. Well, let's say clinic B is an all-cash clinic. They don't take any insurance there at all. But Dr. A is still considered opted in, but non-participating at this clinic. So what does that mean? Well, if a patient goes and sees Dr. A here, because Dr. A is opted in, they automatically have to fill out and submit a claim to Medicare for those services if it's a service that's normally covered under Medicare. And because Dr. A is participating, Dr. A will get paid, which is always a good thing, right? But over here, if a Medicare patient were to show up at Clinic B, Dr. A is still considered opted in, but he's non-participating at this clinic, okay? But because he's opted in, Dr. A is required to fill out a claim form and send it into Medicare for all covered services. But because he's not participating, he won't get paid anything. And because he's considered opted in, they have a little thing in there, and that Congress didn't want doctors to take advantage of old people. That's kind of because when Medicare first came out, 65 was considered like really old. Today, some people would consider that maybe even middle age, depending on how healthy you are. But they kind of considered 65 to be really elderly and kind of on death's bed. And so they were really concerned that doctors were going to take advantage of old people. And so this happens all the time in other things. Anytime you'll hear about on the news where someone knocks on an elderly person's home and says, hey, I was walking by and we noticed that your roof was leaking. Pay us $20,000 and we'll give you a new roof. And then the person gets real nervous and they pay up the money, and then the company never shows back up. Well, Congress was really scared that doctors, because we're such evil people, were going to do the same exact things. And I'm sure there are some doctors out there that do some bad things. But so what they made sure of is that anyone who's considered opted in, we are not allowed to charge cash to anybody for covered services. Whether we got paid for it or we didn't get paid for it, that's it. Whatever Medicare gives us, we have to take it as payment in full. So if you're participating, you might get paid, or you usually get paid. But if you're not participating, you won't get paid, and you're not allowed to go collect that with cash. So when people call our office and say, hey, I have Medicare and I want to come see you, well, Dr. Null, me, I am opted in because I to me, I mean, just business sense, I need to do that because the healthcare system could change at any time. And then, but at our clinic, we don't have a contract with Medicare. But if you come in here, I'm required by law to send a claim in if it's something that Medicare normally covers. And because I don't have a contract, I won't get paid for it, and I'm not allowed to bill you afterwards. So that's why we're saying that we can't see you if you have Medicare for normally covered services. It's not because we hate old people. It's not because we're cruel or mean or what have you. It's because we just don't have a mechanism to get paid there. And if you've seen a physician somewhere else, we get this too. Well, I lived in Colorado and I used to see and pay cash there. Well, that doctor had probably opted out and was allowed to do that. The other way we're able to see you is if you come in for a non-covered service. So non-covered services are things that Medicare feels like they shouldn't have to pay for. And we actually do a lot of those here. That would be something like prolotherapy, PRP, our stem cell therapies, any of our IV therapies. All those are considered non-covered under Medicare, and you can come in and pay cash for those services. So as you can see, this is not something that's really easy to explain over a 30-second phone call. As a matter of fact, medical billing is so difficult now, there's even like an associate's degree. People call up and want to know how much charges are going to be and things like that. It's very complicated in today's system. And it's like I said, there's a whole college degree out there just on medical billing and coding. And so trying to explain it over a quick phone call is very difficult. So that's why we're putting this video together, so we can explain some things and show that, our intentions are good. We're just trying to follow the law. And so, if you were to come in and wanted to see me for just like some osteopathic manipulation or things like that, that's considered a covered service under Medicare. And since I'm non-participating, I'd have to build a claim, I wouldn't get paid, and I couldn't charge you for it later because that would be considered Medicare fraud. And that's big, bad stuff. That's when the FBI comes to your office to pick that up. So we don't want that to happen. So I hope this explains everything. Dr. Nall from thevillageosteopath.com. Have a great day.